Hey everyone, and welcome. As a pharmacist, you know that questions about hepatitis can pop up out of nowhere, right in the middle of a busy shift. So, in the next few minutes, we're going to walk through a really practical guide to managing acute viral hepatitis. We'll cover the key viruses, crucial counseling points, and your role in prevention, all designed to make you more confident in these clinical situations.
So let's just jump right into a scenario that I'm sure sounds familiar. A patient walks up to your counter, they're clearly worried, and they tell you a family member was just diagnosed with hepatitis A. What do? Do they need a vaccine? Something called immunoglobulin? Both? Nailing this advice is critical, and that's exactly the kind of real-world stuff we're getting into today.
All right, here's our game plan. First, we'll do a quick lineup of the different hepatitis viruses, just to get our bearings. Then, we'll dive deep into your role during the acute phase, what to do and what to say. After that, we'll switch gears to prevention and vaccination, and we'll wrap up with the really high-stakes counseling scenarios in pregnancy and breastfeeding. It's a clear roadmap for a pretty complex topic.
Okay, first things first, you gotta know the players. Being able to tell the difference between the 5 main hepatitis viruses is absolutely fundamental. It really dictates everything that follows, from how it spread to what the long-term outlook is for your patient.
As you look at this chart, let your eyes drift down to that last row, the one that asks chronic. This is the big dividing line. You see, hepatitis A and E are usually spread through the fecal-oral route, and the good news is they don't become chronic. But then you have B and C. They're transmitted through blood and body fluids, and they are the heavy hitters when it comes to causing chronic disease. For newborns with hepatitis B, that risk can be a shocking 90%. And hepatitis D? It's kind of a freeloader. It's an incomplete virus that can only infect someone who already has Hep B.
So, what's the real difference between acute and chronic? It's all about the timeline. We call it acute when the infection has been around for less than 6 months. Often, like with hepatitis A, the body fights it off on its own. But if that virus, specifically B or C, is still detectable after 6 months, well, that's when it's crossed over into chronic. And that's the real silent danger, because patients often feel totally fine until serious liver damage is already well underway.
So where do you, the pharmacist, fit into all this? Well, when a patient gets that acute diagnosis, you are right there on the front lines. Your role is huge, from helping make sense of lab tests to giving that essential day-to-day management advice. Okay, let's talk labs. You see a patient's lab report, and for hepatitis B, the first thing to look for is HBsAg, the surface antigen. If that's positive, it's simple. The patient has an active infection. Now, it doesn't tell you by itself if it's new or chronic, but it's the definite sign that the virus is there and that person is infectious.
For hepatitis C, it's a bit different, and this is a huge counseling point. A positive anti-HCV test just means the person has been exposed at some point in their life. That antibody can stick around forever, even if they've cleared the virus. So the absolute critical piece of advice you have to give is that they must get a follow-up HCV RNA test. That's the only way to know if there's an active infection right now.
And for hepatitis A, it's all about the M in IgM. A general antibody test might just show they had it years ago or got the vaccine. But if you see a positive anti-HAV IgM, that M basically stands for right now. It signals a current acute infection. It's the key marker for a new diagnosis.
Okay, when you're counseling a patient with a new diagnosis, your advice needs to be direct and impactful. Number 1, absolutely no alcohol. 0. Their liver is already inflamed and working overtime. Number 2, and this is where you are indispensable, is a complete medication review. You've got to scan their entire med list for anything that could be toxic to the liver. We're talking everything from certain statins to just high doses of acetaminophen.
And here's another specific intervention you need to have on your radar. If the liver is really struggling, it can't make clotting factors properly, and you'll see that reflected in a high INR, usually over 1.5. In that case, vitamin K is the go-to to help correct that bleeding risk.
All right, let's pivot to prevention, because this is where we can really make a massive difference. We can move from just reacting to an illness to proactively protecting our patients through vaccination and just good, solid education.
Think of this table as your mental checklist. Any patient you have with chronic liver disease, they need both the Hep A and Hep B vaccines, period. But you should also be screening other groups, people who use illicit drugs, men who have sex with men, people about to travel internationally. Building these quick screening questions into your daily workflow can literally save lives.
Now, it's so important to get the 2 tools we have straight. On one hand, you have vaccines like Engerix B. That's active immunization. They basically teach your body to build its own army of antibodies for long-term protection. On the other hand, you have immunoglobulins like HBIG. That's passive immunity. Think of it like borrowing antibodies, calling in temporary reinforcements for immediate but short-term protection right after an exposure. They're often given together to cover all the bases.
And here is a fantastic clinical pearl to lock away. Because hepatitis D is so dependent on hepatitis B, if you vaccinate someone against HBV, you automatically protect them from HDV as well. It's basically a 2-for-1 deal when it comes to protecting the liver.
Now for our final section, and this is where things get really serious: counseling during pregnancy and breastfeeding. The advice you give here is absolutely critical because the decisions made can directly affect the health of a brand new baby.
Let this number just sink in for a moment. 90%. That is the risk of a mother who has a specific marker called HBAG transmitting hepatitis B to her infant during birth if nothing is done. And for most of those babies, that infection will become chronic for life. This is a preventable tragedy.
So how do we prevent it? Here's the key counseling point. For pregnant patients with a very high viral load, the specific number is an HBV DNA level over 200,000. We recommend starting antiviral therapy, usually with tenofovir, in the 3rd trimester. This simple step dramatically lowers the amount of virus in the blood and cuts down the transmission risk at birth.
Now, just for contrast, let's look at hepatitis C. The risk of passing that from parent to child is much, much lower, around 5%. It's still a concern, of course, but it really highlights just how aggressive and unique HBV is when it comes to vertical transmission.
You are guaranteed to get questions about breastfeeding. So let's make the answers simple and clear. For hepatitis B, the answer is yes, breastfeeding is safe if, and this is a big if, the infant gets both the immunoglobulin and their first vaccine dose right at birth. The only time to pause is if the nipples are cracked and bleeding. For hepatitis C, the counseling is even more straightforward. It's considered safe.
Really, this is the bottom line. This is the whole thing when it comes to preventing HBV transmission. The standard of care, the thing you have to reinforce over and over, is that the newborn must be immunized at birth with both the immune globulin and the vaccine. That 1-2 punch is the cornerstone of prevention. So, we'll end with this challenge for you. Think about your actual daily workflow when you're doing a med review, filling a new script, or just chatting with a patient. Where can you build in a quick 2-second question to screen for viral hepatitis risk? How can you make vaccination screening a routine part of what you do? Because that is how we take all this information and turn it into action that actually protects our communities.